One of the gateways to health insurance in Oyo State is basic care provision fund. You know that I've spoken to you before about various ways you can get into Oyo State health insurance scheme. One of them is a conventional scheme, one is community-based insurance, one is pensioner scheme. So basic care provision fund is one of the ways through which you can get into Oyo State health insurance. And basic care provision fund is fund for the vulnerable and the poor provided by the federal government after Oyo State Government has met certain conditions. So we have the fund because Oyo State Government has done our whole part, for which we want to thank the government of Oyo State, ably led by His Excellency Gov Seyi Makinde. We started enrolling into basic care provision fund about 3 years ago. We are using our innovations to ensure that we have more lives covered in your state than expected by the federal government, and that's kudos to Oyo State Health Insurance Agency. So today we've enrolled over 40,000, actually 41,050 thereabout, the number of lives we enrolled in Oyo State. And because that gateway is meant for the poor, the needy, pregnant women from grassroots that don't have regular income, children under 5, of those category, of people that are poor, that are living in grassroots and rural area. So we're careful to ensure that the right people are brought on board. We don't want to make a mistake, or we don't want people to abuse the system of getting the wrong people to enroll under basic care provision fund. So the conditions are tight. We have validation criteria to ensure that we get the right people. So we use that, done that, and we have 41,000 lives enrolled. Good news, we started another batch of enrollment today, 31st of January 2024. We want to enroll another 40,000 lives into basic care provision. And our people are in various local government as I speak, on our local government, Ido local government, Oduyode and Lagelu. That's where our people will be enrolling for this week. And then next week we go to other local government. As a matter of fact, besides the 4 local government I've mentioned, we're in Egbeda, Ibadan North, Ibadan Northeast, even this week, Ibadan Northwest, Akinyele, Ibadan Southeast, Ibadan Southwest, Ibadan Northwest. That's where we're doing enrollment as I speak. And one thing that is unique or innovation that we brought into this enrollment, like Oyo State Health Insurance Agency will always look for a way to make enrollment easier, enrollment friendlier, so that bottlenecks will be removed. Basic care provision fund, because people are paid, the government are paid for people to come in. So there's tendency for utilization to be low and be poor. So we brought in another innovation into enrollment in Oyo State. We give you your ID card on the go. So you're done with registration, enrollment, you are captured into a database, and you have your ID card immediately. That will help utilization, especially under basic care provision fund. At the moment you are captured under basic care provision fund, you go to the hospital. Pregnant women, children under the age of 5, the elderly. The moment that you are captured, collect your ID card today, visit your provider tomorrow, register your intention. Even if there's no sickness, nothing, just go and show face. Another thing we are doing is we are enrolling you in the primary care center that is closest to you, walking distance, so that you don't need to spend the money you don't have, to visit your primary care center. So you can go there and visit the matron in charge and say, "Matron, I've been added into your facility. I want to see your face, see how beautiful you look," and then begin to have access to care. That's what you've done. Basic care provision fund will give you access to care in the following area: admission, surgery, delivery, whether it's what we call normal delivery, in medicine we call delivery per vagina, or there's assisted delivery, which we popularly, the type we popularly know is cesarean section, is covered under Basic Care Provision Fund. Some other surgical intervention for male, female, are covered. And then you have treatment of the care for your eyes covered, the treatment for your ear, nose, and throat covered under Basic Care Provision Fund. And even for secondary services. Secondary service means in your primary care center, the challenge or the ailment or the problem, cannot be taken care of, and then there's a need to refer you to a general hospital, or there's a need to refer you to a tertiary hospital. That is covered under Basic Care Provision Fund as well. And in secondary care, we care to do as many interventions as possible because the funds are available. We want healthy Oyo State. We want healthy people. We want Oyo State people to be productive. And that's why Oyo State Health Insurance is taking care of your health, and then by extension, your economy, and then by extension, the well-being, of the people of Oyo State, so that productivity will increase and we have a happier Oyo State. Follow us on our various platforms where we let you know the next local government or the next area we go the following week. I know that most of the people listening to me, because your social media, we might be young and this and not, but we have people in villages, so please relay this news to them. We have uncles, we have aunties, we have our parents living in villages, rural area. You've been paying for them for their medical bill. Now you have an opportunity to get them enrolled, and that again will reduce your own out-of-pocket care, for your parents, for your uncles, for your aunties, for your relations. Just send this message to them. Basic Care Provision Fund, Oyo State Health Insurance Agency is enrolling into Basic Care Provision Fund. It's meant for pregnant women, children under 5, the elderly, and the challenged, the handicapped, in our society, Oyo State. So go and enroll. We expect you to come on board. Get your ID card immediately. I've said that. Don't say come and get ID card tomorrow. No, get your ID card immediately. Visit your PAC, Primary Care Center, that is nearest you be enrolled. Thank you. Oyshia de Oyo. Good day.